One of the most common things that I see in my clinic is pain in the front of the foot, or we call it forefoot pain. It's seldom complicated to deal with. In fact, it's usually pretty easy. This condition is very common with people with a high arched foot and the elderly who lose fat pad in this area as they get older. But if you picture the high arched foot puts all of the pressure here and here. The heel is the biggest, strongest bone in the foot. It can generally handle what we throw at it. However, this series of smaller bones and joints tend to need a little bit of help with the high arched foot because they can't handle what we're throwing at it. So generally speaking, we want to provide a little bit of support here to offload here. On the note of arches, everybody knows about this arch. Not everybody knows about this arch. These bones and joints function best in this formation, which I'm exaggerating with my hand. A couple of things happens when this transverse arch, it's called, when it collapses. A couple of things happens. Number one, when that collapses, these joints take the brunt of the pressure. That can result in inflammation and pain. The less obvious thing that happens when this arch collapses is watch the space between here. That's where the blood vessels and the nerves travel through. When this arch collapses, that space gets jammed up and tight and it can pinch. This can result in a lot of pain in the front of the foot. How do we treat this painful condition? It's actually very simple. A lot of practitioners will lean towards cushion in this area and a metatarsal pad. The job of the metatarsal pad is to go not against these heads, that will generally be very uncomfortable, but in the fleshy part, just behind the heads, right in here, where the foot can absorb it and make it so that this transverse arch is back intact. This is going to open up the space in the front of the foot, allow blood and oxygen to get where it belongs, which helps with the healing process, and stop pinching the nerves if that is also a contributing factor to the pain. In my view, what is more important than anything that I've just discussed is loading the foot up here. Because this device is spring-like and the materials that we use are spring-like, I can get very aggressive through the midfoot. The more I can load the foot up through here, the more we offload up here. My strategy with attacking forefoot pain is to shift the weight, shift the pressure, shift the abuse back into the flexible part of the foot that can absorb it and offload the front. It's 80% about offloading the area and loading it here, and 20% about cushion and a metatarsal pad to keep this arch intact. Very simple. Our success rate with this condition, as you'll see in the chart on the website, is 85%.